All right, well, we're going to go ahead and get started here, and I'll keep the chat open there, so I'll look for any questions that you might have as we're going through. Thank you very much for the opportunity to share again this year. This is my 4th year sharing. My name is Dr. Steve Tullius, and I'm going to be talking about the impact of malalignment of the craniocervical junction on brain hemodynamics, autonomic function, seizures. So basically, misalignments of the upper neck, which can affect the blood flow and the autonomic nervous system, or that vagus nerve that I know is talked about quite extensively in the area of epilepsy. So I'm going to talk about my clinical experience and also the science and the research, what this topic shows us. So let's go ahead and dive into this. Quick disclaimer, this presentation is offered for general information purposes only and is not to be relied upon as medical advice or for any diagnostic or treatment purposes, right? So just a little bit more about myself. I've been in practice 20 years, pediatric and family chiropractor. I've lectured internationally on multiple topics within the profession, outside the profession, on everything from epilepsy to autism. Autism is another big clinical focus of mine. I'm a former director of the Autism One Pediatric Chiropractic Continuing Education Program, and have been highly involved in just moving the chiropractic profession forward in research, education, and politics. My office I have 2 practices in San Diego. I'm not currently in active practice. I do go back periodically. I will be back later this or next month. However, and the reason I'm not in practice right now is so I can do more outreach and get this message out to the public in terms of how beneficial it could be for so many people. And the reason we get the types of results we get in our clinic and other clinics like ours, because we have a different approach. We start with a salutogenic perspective. And salutogenesis comes from the Latin for health and creation. So the creation of health. So I believe, and I know that the majority of the public also believes this, is that we're actually designed to be healthy and not sick, right? And so I focus on removing barriers to our natural state, removing interferences to health, because I believe everyone is designed to be healthy. So instead of looking at treating disease, I look at disease from a very different standpoint of it not being our natural state. And so something must have happened to get us to that point. And so that approach is a very successful one for many different situations. It was for Liam here. I'm going to be sharing, last couple of years, I've shared a lot of the cases more towards the end. I wanted to share more in the beginning here so we can understand just how impactful this approach could be. Liam came to my office at 3.5 years old. He started having seizures 9 months prior. It was not responding to any types of treatment. He was on multiple medications. He was having absence seizures, drop seizures up to 60 per day, and occasionally grand mal seizures too. Within the first 2 weeks of care, his seizures started to go down in frequency, and until the point at 4 weeks when they were completely gone. He did go away for 1 week on vacation at that point. He had 1 seizure while he was away, and then he came back and his seizures went away again during that first week of care that he got back. And now he's been seizure-free for over 7 years. And so his case, his is actually one of my first epilepsy cases. In chiropractic college, we don't get to see a whole lot of cases like this, even though in my profession's history, it was actually quite common to see seizure cases. But due to various situations in the profession was kind of forced into more of a musculoskeletal model, neck pain, back pain model. And unfortunately, the original purpose and practice of chiropractic has become less and less focused on. And so I will be sharing on what to look for in finding someone who can help if this is something that you want to have evaluated. And so I put together a case series. I need to have this published. I'm still gathering the data, but there's 25 cases that presented to my office. And this is what I just put together, some of the preliminary data. 9 of those cases, or 36%, had complete resolution. 11 had significant improvement, where they had 50 to 75% reduction. So 44% of the people. Slight improvement was seen in 4 or 16%, and only one of those cases there was no change. So pretty significant improvement. 80% had either significant improvement or complete resolution, and that was across multiple types of seizures. Not only, it wasn't like we only saw particular types of seizures responding. In fact, we've had quite a few of more genetically driven cases, like Dravet syndrome, Tay-Sachs disease, CDKL5, genetic situation there. So I'll talk about why that is later in the talk here. So in general, resolution was seen in 2 cases at 3 weeks, 2 cases of those 9 at 4 weeks, 1 case at 6 weeks, 1 case at 8 weeks, 2 at 12 weeks, and 1 at 32 weeks, with an average of 10 weeks. And typically, typical frequency is seeing someone 3 times per week, sometimes more. In cases like this, I actually, in seizure cases, it's not uncommon for me to actually see people twice a day, daily, until we start to see a shift in the seizure frequency. And again, my goal or my approach is not to treat the seizures. Okay, it's to address the imbalance, the misalignment, or what's known as a subluxation in the Craniocervical Junction, the upper part of the neck. And so, because we know that 1 in 3 people with epilepsy, they're living with uncontrollable seizures, it's intractable, treatments aren't working. This means we need to really be investing a lot of time and energy and looking into things that could potentially help these people, not just the 1 in 3, because in my experience, we've been able to help a lot of the people who have controlled epilepsy, where they're using medication to control it as well. 6 out of 10 people don't have a known cause of their epilepsy, meaning they're just, we don't, at this point in time, we don't know why. It's not caused by any other genetic condition or medical condition. So, and I think part of the challenge is that we're looking at it. This is from the Epilepsy Foundation website, where they say that the human brain is the source of human epilepsy. And I'm not entirely convinced that's the most accurate picture of the situation. Yes, is the electrical activity happening in the brain? Is the seizure itself happening in the brain? Yes, it is, but we have to remember that the brain does not exist in a vacuum, right? The brain is a tool, it's an organ that allows us to sense our environment, and it gets all this incredible amount of information through our sensory nerve endings, through our eyes, ears, taste, all this information coming from all of our organs, all of our cells, bombarding the brain, so the brain can make sense of all this information and then respond accordingly, so it can help us adapt most successfully to our internal environment, what our body's needs are, and our external environment. If you touch a hot stove, you immediately pull back because you get that sensory information in, and you adapt to it. And so I think we need to start looking at this situation more from a functional perspective, like in terms of, okay, what does the brain need to be healthy? What are its basic needs? Well, the brain needs to have it needs nutrition, right? It needs fuel. How does it get that? It gets that through the blood supply. And so we need to ask ourselves questions like, okay, well, what's going on with the blood supply to the brain? Is the brain getting enough nutrition? We need to ask ourselves questions like, well, okay, all this activity is happening. That means that the brain is producing toxins, just like any other organs, that it needs a way to get rid of it. How does it do so? It does so through the cerebral spinal fluid. That's the fluid that circulates around the brain. It also brings nutrients to the brain. It also provides protection, and so that if we have an injury, that there's some cushioning inside of our skull there for the brain. So we need to start to look at it from those types of perspectives. Another way to look at this, is if we were to go home at night, we've been out at a party, we go home and all the lights are off. We're flipping all the switches. We don't go and the logical conclusion is not, let's go change all the light bulbs. we would go to the circuit breaker box. And so we need to have a more functional perspective when it comes to the brain not working functionally. And one of the things I personally, this is my personal opinion, I look at seizures as potentially the way that the brain is trying to reboot itself, that it can't handle, for whatever reasons, if it's not getting enough blood supply, or if it's can't adapt to all the information coming into it. It's too much, either too much sensory information, or it can't process the information properly. Then much like a computer that needs to be rebooted when it starts to slow down and get stuck, well, perhaps that's what the brain is doing, right? And so we need to start looking at it from a different perspective here. One of the perspectives we've failed to really look at this situation from is a biomechanical one, okay? Which really boggles my mind. Of course, now I'm a chiropractor. This is what I spend my entire professional career doing. But this, fortunately, is beginning to be talked about more and more in various circles, between orthopedics to physical therapists, osteopaths. There are more and more professionals talking about the cranial or the cervical cranial junction, which is this area here. Here's the back of the skull here, and then we have C1 and C2, the top two bones of the neck. Now, these are these two bones of the upper neck. They are the only two bones besides the sacrum, the tailbone, that have a special name. C1 is known as your atlas bone, and C2 is known as the axis. It's called the axis because it provides a pivot point for the atlas bone to turn around. C1, known as the atlas bone, is called the atlas because it's named after that mythological figure holding up the world. That's what it does for you, because here's what we have here. We have your spinal cord that comes out through this opening right here called the foramen magnum, which means big hole in Latin. And your spinal cord travels through there. That's how all the information, or the majority of information, to your brain is sent. It's also how your brain sends the majority of information to the rest of your body so that it can do everything it knows and needs to do. And we also have, you can see these red vessels here. This is your vertebral artery, which travels up. It's actually protected by the bone here, travels up inside the bone, and then wraps around the atlas bone. It goes up and through and around, and then wraps up and goes up into the foramen magnum to provide 20% of the blood to your brain, and specifically the blood to your cerebellum, to your brainstem, hypothalamus, thalamus, and to parts of your spinal cord. So extremely important that this area is functioning properly. Now, it is also the most mobile part of your spine, okay? The rest of your spine, all these lower vertebrae, are locked in place more readily more efficiently, because they need to provide more limited motion. They're there more for strength and support and stability, okay, to protect your spinal cord and for your muscles to attach to provide movement. Now, at the very top, though, we need to be able to have a great range of motion. Just move your head and neck around, turn behind you. If something's coming at you, you need to be able to turn quickly and have great degree of motion. That's why it's shaped very differently. That top bone, that atlas bone, is shaped it's more flat. Now, because of the shape and because of the need for more movement, it also means that it can misalign more readily due to various situations, traumas, injuries, postural stresses. Now, in this day and age, using tablets, cell phones, texting, all these different things, sitting in school all day, working at a computer, this area is highly susceptible to stress and injury and misalignment. And if you Google atlantoaxial instability, you'll find some doctors starting to really address this. And chiropractors have been addressing this for over 125 years now. Okay, and so here's another view. You can see from the front, the vertebral artery passing through, again, because it's so critical that the brain get the proper blood supply, that it's protected by the bone itself right there. Here's a cross-section view from behind. You can see the spinal cord, the cerebellum, some of the structures there. And here's the main blood supply, how the brain gets its blood supply. Two ways. One is the vertebral artery, which we just talked about, which is traveling up through the bone, wraps around the atlas, that top bone. And then it forms what's called the basilar artery here. And then you can see it on this view here at the bottom of the brain. And again, the vertebral arteries supply 20% of the blood supply. And then you have the internal carotid artery, and that provides 80% of the blood supply to the brain. So does it make sense that if there's a misalignment, you can see what happens? This is a graphic where you can see if that stretches, if this C1 bone is misaligned, or even C2, that's going to put extra stress on the vertebral artery as it passes through that junction at that opening at C1, and then passes up into the foramen magnum. Now, it's not the only structure that passes closely to the C1 and C2 vertebrae. Okay, here we have the brainstem. Off of the brainstem here, we have the vagus nerve. Now, I know, I'm sure you've all been, reading and hearing about, and maybe some of you even have vagus nerve stimulators. Fortunately, there's a whole lot of research going into this vagus nerve, and not just in epilepsy, but in depression, anxiety, obesity, you name it. The vagus nerve is actually highly involved in a vast amount of chronic disease processes. So here we have the vagus nerve, and right here, right at C1, is the nodose ganglion of the vagus nerve. Now, consider this, if you Google Dr. Ross Hauser, he's a specialist in atlantoaxial instability. He calls this nodose ganglion the brains of the vagus nerve, and it sits on, and it passes right in front of C1, the atlas bone there. Now, if you're not familiar with the vagus nerve, just think of the vagus nerve as one of the most important nerves in your body. It comes from the Latin for wanderer, because it wanders down into your abdomen, and it provides the nerve supply to the majority of your organs. Okay, and it helps keep them in a nice homeostatic balance. So, and it controls what's known as your parasympathetic nervous system, or what I call your resting, healing, digesting, and development system. The other side of that autonomic nervous system, which it's a part of, is your sympathetic nervous system, and that's your fight or flight response. That's what controls your fight or flight response. And we know that the vagus nerve is the primary driver of inhibiting that fight or flight response. And we also know that fight or flight response, we can get locked into that fight or flight response, that stress response, due to early life stress or traumas, whether it's physical, chemical, or mental, or emotional, throughout our lifetimes. And there's ways to monitor that. The standard of care, or the standard method of measuring whether you're more in fight or flight or more in resting, healing, digesting, whether or not you have a better vagus tone or not, is heart rate variability. I'm going to talk more about that in a moment, but that should be every individual, that should be part of standard healthcare. Every individual should be getting heart rate variability testing as a part of wellness. However, absolutely in cases with epilepsy, that needs to be monitored and should be monitored. So here we have, again, another image of the vagus nerve here on the left, and we also have the superior cervical sympathetic ganglion. Okay, now this is part of the sympathetic nervous system, and this is highly involved in controlling the blood supply to the brain, and that is inhibited and controlled by the vagus nerve. The vagus nerve is it's like the captain of the ship, right? And it should be monitoring and controlling things like the blood supply. And so the relationship of this area is highly, highly important. This is why the Craniocervical Junction is so important, because of all the structures that travel through this region. Now, I think this is the perfect time to mention this study. Okay, this was a 2007 study in the Journal of Human Hypertension. This was featured in mainstream news because it was a really big deal. They had 50 patients in this study at the University of Chicago, I believe. And these were people with stage 1 hypertension, and it was a double-blind placebo-controlled study. And what they did is they looked to see if they had a vertebral subluxation, or what's known as a misalignment of the upper neck. And they provided one adjustment, one procedure to help realign that vertebrae, restore proper motion. And on average, they found a 14 millimeter drop in this systolic pressure and 8 millimeters in diastolic pressure. This was the same amount of change that it would normally take 2 different drugs to have that same sort of effect. And this impact lasted for 8 weeks, right? So while it may not be specifically related to epilepsy, it is related to the blood supply and blood pressure. And the most likely reason that they had that effect is because it impacts the autonomic nervous system, which I'm going to share some more in a little bit. This slide here, this image is from Dr. Ross Hauser, where he showed 2 different x-rays. Here, this is what a normal curve should look like. This is a normal cervical spine curve. It should look a little bit like a C right here. On the other side, there's an abnormal curve, in fact, a reversed curve, okay, which can be quite common. It's not always to this degree. Many of us have very straight necks due to traumas or due to repetitive stress and strain from postural changes over time. And so you can see he superimposed where the vagus nerve should be and what it would look like normally. And you can see what would happen, with the change in biomechanics, the change in posture, the change in position, how that's going to stretch and potentially irritate that vagus nerve. So here's another study. This was a smaller study. It was a pilot study. 20 healthy students. So it's a smaller study, but they looked at cerebral artery blood flow. Okay, they looked at the blood flow for these individuals using transcranial Doppler ultrasound. And they found it was a transient change, so it did go away, but it was a significant change in the middle cerebral artery blood flow. That's this area right here, the middle cerebral artery, which provides a lot of blood supply to various parts of the brain there. And they did see an improvement after an adjustment of the upper neck there. So, in preparing for, and this is the 4th year that I presented this information. Some of it's the same information I presented in past years for the Epilepsy Awareness Day. But this is important. This is looking at what happens, during and before seizures. And so this particular study, they looked at the cerebral blood flow. It was measured in the middle cerebral artery, and they saw a significant decrease by 20 to 24% during spontaneous absence seizures. So now what was really important to note is they say that neurogenic control could also influence cerebral blood flow responses. So neurogenic meaning the nervous system controlling this. And they comment that the cerebral vessels are encircled by a dense network of sympathetic and parasympathetic innervation mediating this contraction and dilation, right? So they're recognizing that this blood supply issue may be due to issues with the autonomic nervous system, right? That fight or flight versus resting, healing, digesting system being able to properly open and close blood vessels to get the proper blood flow to the brain. So this is a more recent study. This was in Epilepsy Research Journal in 2017. And this was 19 patients with idiopathic generalized epilepsy. And they did MRI type of testing, and they found, they detected interictal. So interictal is the period before seizures, so in between seizures, so in normal resting states. And they found hypoperfusion of blood. So hypo meaning less than in the thalamus, upper midbrain, and the cerebellum in idiopathic generalized epilepsy. And the thalamus and cerebellum particularly their main blood supply is from that vertebral artery. So I think that's important to note that. Other studies, they're finding similar findings. In this study, they found ipsilateral, meaning same side. So the same side that the seizure is on, they also found that there was same-sided decrease in blood flow in the temporal part of the brain, the temporal lobe, compared to the opposite side of the brain where the seizure was not happening. Okay, so they found that there was less blood flow in the area of the area of where the seizure was occurring, but they also did find global decreases in blood flow for these individuals as well compared to the controls. Another study here in 2016, 20 patients with refractory focal epilepsy, and they again found interictal. So this is before the seizure is happening. They found same-sided hypoperfusion, so not enough blood supply, and hypometabolism, meaning that not enough glucose metabolism was occurring in these areas in 18 out of 20 people. So not enough nutrients, not enough blood supply, not enough then oxygen, for these areas of the brain. And here's another similar findings: 12 drug-resistant focal epilepsy patients. I think it's important to note that 2 of these studies so far, one was idiopathic epilepsy, generalized epilepsy, so they don't know how it's caused. This one is drug resistant, so it's not responding to some of the other types of therapies out there. So then they found significant hypo and hyperperfused areas in all of these cases. And interictal hypoperfusion was observed at the site of the seizure in 10 out of 12 patients. So again, before the seizure is even happening, in normal resting phases, there's not enough blood supply. And finally, this was a 2007 study in epilepsy currents. Recent data indicate cerebral blood flow, although focally increased at the onset of a seizure, may be temporarily inadequate to meet the metabolic demands of both the resting state and the actual epileptic state, right? And so I think we need to be putting a whole lot more attention into whether or not these brains are actually healthy brains. They're just not getting enough blood supply potentially. So this is from the work of Dr. Scott Rosa. He's a great person to look up. He's doing, he's a chiropractor, and he's doing a lot of work in the area of the Craniocervical Junction and functional MRI, meaning a regular MRI is one moment in time. It's static, so we just see that one moment. Functional MRI actually sees the fluid flow. It sees the dynamic flow of fluid, blood flow, and cerebrospinal fluid flow. And what he stated in this chapter from this book, which was Hydrocephalus, Water on the Brain, he said that rotary misalignments of C1, C2 can impair the normal cerebrospinal fluid flow, as well as contribute to an insufficiency of blood flow of the vertebral basilar system. So the blood flow, getting that 20% of blood flow, that these misalignments, these rotations of C1 and C2 interfere not only with the cerebrospinal fluid flow, but also with the blood flow. This is from the Craniocervical Syndrome and MRI. This particular book is written by multiple authors from various disciplines, medical doctors, orthopedists, various neurologists. And in his particular chapter, he highlights some of his findings, and notes that these misalignments not only cause neural compromise, so pressure on the nervous system, whether it's the brainstem or impacting the vagus nerve, but also interfere again with that cerebrospinal fluid flow and blood and venous flow. And here's a bigger image that you can see some pre and post imaging. So this was before he performed an adjustment. You can see areas where, so on an MRI, the white areas means that there's more fluid. So if you take a look up here at the top, this is where the cerebrospinal fluid should be flowing around the brain. You can see a significant difference on the left versus the right. After this is post care, where now we see it's much more clear. We see a lot more white in that area, meaning there's more fluid. And then we see over here on the left, down at the spinal cord, this is, right here, this is the Craniocervical Junction area right here, C1 and C2. We see this dark area, and over here on the right, we see that it's more open, it's more white. We see more flow of fluid in that region. So we're seeing some really cool before and after studies. Here you can see, and this may be kind of hard to visualize, on the left, we're looking at a cross section, looking at, like, if you're looking at your body from above, looking down, and this red line should be parallel with the horizon. It shouldn't be tilted. And because what it's measuring there is a rotary misalignment, of the C1 and C2 vertebrae, based upon these anatomical landmarks right here. And this one on the right is looking at the spine from behind. A couple things. We see the on the left, there's this part of the cerebellum, which is coming down lower than it should. There's evidence pointing to the fact that when there's stress and tension in the spinal column, that it will actually pull parts of the cerebellum down into the foramen magnum, and that can also create a blockage of the cerebral spinal fluid flow. And we also see here with this red line, the tilting of the atlas bone. C1 bone is tilted. So it's not, it should be parallel, it should be parallel with the horizon right there as well. So that also signifies a subluxation or misalignment of that vertebrae. I'm going to kind of move through this kind of quickly because I want to get through a lot of this. But this was, if you look up Dr. Michael Flanagan and his work, he specifically looks at the Craniocervical Junction and the hydrodynamics and the relationship to various neurodegenerative conditions such as Alzheimer's, ALS, other MS, other neurodegenerative conditions. And he makes the case that it may be due to chronic insufficiency of blood supply over time. So I like to bring up this case here, one, so you can get, make this more real for everybody, and also share the particulars of her case. So this young girl, she came to me, she was having seizures, she was having partial complex seizures. They had started, I think it was 2 months prior. They started soon after she had an injury to her spine. She was on a trampoline and fell and landed on the part of the the metal part of the trampoline. After that, she couldn't touch her toes. She couldn't bend down all the way. She had really bad back pain. And then the seizures started approximately a week after that. Okay, now her medical team, told them that the seizures were not related, that it was, just a coincidental finding. However, here's the thing: we found that she was absolutely subluxated. She had a misalignment of not only her upper neck but also her sacrum. And if you have pressure at both of those regions, that's going to put tension on your entire cerebral spinal fluid system. Okay, and that's going to then put pressure on the brain. Well, we started taking care of her. After her first visit, adjusting her spine, she was able to touch her toes. And then her seizure started to go down that week. And at 3 weeks, she was seizure free and has since been doing really, really well. So that case, I believe, was not only an issue with the upper neck, but it also was related to lower part of the spine, which isn't as common, but it was due to a traumatic event that she had, that had happened to her. So you've heard me mention this term vertebral subluxation. It's basically a big word for a misalignment. It happens most commonly in the upper neck because of the unique anatomy and because of that extra degrees of motion and because of the way we use our bodies. That area can encounter lots of stress. Here's what we know. We know that structure always affects function. You can't take out a load-bearing beam from a bridge and expect it not to affect the strength and stability of that bridge. Our bodies are no different. And unfortunately, we're not looking at our bodies and the problems that they may have from a more biomechanical perspective and functional perspective. But here's what we know. I'm going to share some of the data here. That when there is a subluxation or misalignment of that upper neck, it will negatively impact the autonomic nervous system. And it should make sense because I've already shown you where the vagus nerve travels, and also your spinal cord travels through this region right here. It can alter brain and blood flow. It can alter this cerebral spinal fluid dynamics there, which I've already pointed out. It puts the body into a stress response, which is going to increase inflammation globally. It's going to cause increase in cortisol and also create tension in the spinal cord itself due to the tension that's occurring there. So here's some of the research in chiropractic and seizures. Now, we don't have double-blind, randomized, clinically controlled trials, and the reason for that is chiropractic is a self-funded profession. We don't get funding from the largest funders of research in healthcare, which is the pharmaceutical companies, because we're not offering pharmaceuticals solutions. So And unfortunately, the federal government at this point is primarily funding low back pain, neck pain research, and not research in this particular area, which is why I have dedicated my professional career to this particular topic, because I know that there's a vast amount of people that could be served that aren't being served because they simply don't know about it. Okay, so in doing a review of the literature, I found this article here. It's a 2001 review of the literature. So they looked at all and it is, it's 20 years old now, so we definitely need a newer one. And I'm going to present some information right after this slide, but they found 17 reports, 15 patients in those 17 reports. Of those 15, upper cervical care, upper neck chiropractic care was delivered, and all 15 had positive outcomes. So I would make the case that even though we don't have the double-blind, clinically controlled randomized studies yet, that there's a plethora of clinical data, clinician experience, patient experience, and certainly anatomical and scientific data that would suggest that this approach and upper cervical evaluation of that craniocervical junction should be a standard of care for individuals who are having seizures. It should be just one of the things that everybody does. I can't stress that enough based upon what I've seen clinically and just what I've presented so far. These next two slides are just these are various case studies. So of people who have undergone chiropractic care who had seizures. So I found a total of 31 in the literature so far. I need to publish mine. I have 25 cases just in my data alone. And so again, I think that the case is absolutely there for people, and considering the fact that the care and the approach is exceedingly safe, and especially compared to the possible ramifications of other types of therapies. This particular child came to me at 5 years old. He started having seizures several years prior. He was having grand mal seizures and also absent seizures, approximately 15 to 20 per day. And we saw his seizure frequency start to decrease within the first 4 weeks, and then it resolved after 32 weeks. Now, and he's been seizure-free for 5 years. Now, here's something that I've actually seen quite commonly. Okay, now when they did the MRI for this child, they found an abnormal finding in the brain. I forget the exact terminology they used, but it was either the size or the shape. And so the diagnosis then was that, okay, well, he's having seizures because of this abnormal finding, when in reality, that wasn't what was causing the seizures. If they had never done an MRI, they wouldn't have known that he had this oddly shaped portion of his brain, and it was just an incidental finding, not a causative factor in his seizures. Now, I mentioned that I've seen a decrease in intensity and frequency of seizures for individuals who have seizures that are caused by or related to genetic conditions such as Rett syndrome. This particular child has Rett's, Tay-Sachs disease, various other types of genetic situations. We also see a decrease in seizures. And the reason for that, think of it this way. We know that seizures are triggered by stress. If we look at the data, I presented this last year. I took it out of this year's presentation because it's just too much information. But we know, based upon the research, that seizures are triggered by various stressors. And our autonomic nervous system, our vagus nerve, is in charge of controlling our body's ability to handle stress. Right? We all have different levels of stress resistance or resilience. So one person can be more resilient, able to handle more stress than another. And I call that your stress bucket. We all have different size and shaped buckets. Now, if we have a genetic condition, that could mean our bucket is smaller. If we have a subluxation or misalignment in our neck impacting our nervous system, that can make our bucket smaller, right? So that means that it doesn't take as much stress, to fill that bucket and then trigger the event, trigger the seizure, or trigger whatever is going on in that person's life. So what chiropractic and other therapies do that increase the size of the bucket by increasing the health of the nervous system and the autonomic system is increase the bucket so that you can handle more stress. And so that's why we see, I believe, in my opinion, why we see individuals who have more genetically driven situations, why we see a decrease in seizure frequency for them as well. He had a diagnosis of epilepsy at 20 months, also autism spectrum diagnosis as well. He was having up to 800 seizures per month. Within the first month of care, we saw a reduction by 95% of the seizures. He was in massive fight or flight too. He was just, you could see it in his eyes, and he was hiding under tables, and his whole system was in massive fight or flight. Now, here's before picture. Now I look at this, and then here's after too. If we look at the before, we see that this massive head tilt, but not only, and that could just be postural, right? But then if we look at his legs, his feet, he's flat-footed and his knees are going in. Those are all, that's what happens when the biomechanics in the neck are off. It causes one hip to be higher than the other, causes the knees to bow in, and will cause flat-footedness. It's one of the things that we're looking for to see if there may be a problem in the upper neck. But he also, one of the coolest things was he started to become way happier too. Here's another case, another child, image from the back. If you take a look at the ear position, and I add these lines to give you a better idea, you see how far off those ears are, the shoulders, and then the shoulder blades. This is clearly a case where there is massive biomechanical issues stemming from the upper cervical or upper Craniocervical Junction, malalignment, and this is going unrecognized in the vast majority of the population because very few people are looking for it. Now that case before that, with the child with 800 seizures, I have learned, they actually did have a vagus nerve stimulation device implanted, and his seizures have gone down. It's actually been even more beneficial. So there's certainly a time and place for that. However, I think that we need to start thinking about this from this other perspective, was maybe that vagus nerve just has pressure upon it. Maybe it's being irritated constantly, and maybe it doesn't need to be stimulated externally. Maybe we just need to take the pressure off the system to allow the body to do what it's designed to do, which is heal and thrive. And so while I do think there's a great degree of benefit for people through this, and we should explore it, I think we should look at some natural options as well, and start asking this question more and more. Is epilepsy more of a symptom of dysautonomia or dysfunction of the autonomic nervous system versus the brain being the problem, right? If we keep looking at it from this perspective, I think we're going to find a whole lot more answers. Again, I mentioned heart rate variability. It's the gold standard for measuring this delicate balance between the fight or flight sympathetic nervous system and the resting, healing, digesting system. And it's a really simple test. It's non-invasive. It involves, there's a couple ways to measure it. In our office, we use a device where you put your hand inside of it, and it measures the intervals between your heartbeats. It also is measuring the skin temperature and sweat gland activity. So we get 3 different layers of the autonomic nervous system in that test. Another way to do it is to attach the device to the chest or to the ear. And it's super inexpensive. This should be a standard of care across every type of care provider. And so I've done a ton of research into this topic because here's the thing. It's not only epilepsy. It's pretty much every major condition you can think of. When we look at major depression, we look at anxiety, we find the same thing. And these are reviews of the literature. We find that people with mental health challenges, major depression disorder, anxiety disorder, they all have really low heart rate variability. And low heart rate variability means that you are more in fight or flight physiology than in the resting, healing, digesting side. That's where the body heals, and where it sleeps, and where it thrives. So it's not just mental health, it's rheumatoid arthritis, lupus, multiple sclerosis, Alzheimer's. All these various conditions are all showing the same thing, that there's a very negative imbalance of the autonomic nervous system, or the vagus nerve tone of the body. chronic fatigue syndrome, fibromyalgia, Parkinson's, the list goes on and on. So when it comes to epilepsy, we know that this is also a review of the literature. This is from 2019. They say that autonomic changes often precede the actual seizure, and therefore provide a promising tool for timely seizure detection. Now they're talking about, well, let's detect the seizure before it happens so that we give people an alert, right? Which is great. However, what if we start to recognize, well, what if instead of just detecting it, let's correct it before it even happens? So it says autonomic alterations may therefore provide an adequate tool for early seizure detection and facilitate timely interventions. And here's another review of the literature. 39 studies were included. They found significantly lower heart rate variability than the controls, right? So low heart rate variability means higher sympathetic fight or flight tone. Okay, now the sad thing about this is this means that it's higher predictors for morbidity and mortality as well. Like, this is a super incredibly important topic that we need to solve in this particular area. Another study here, 26 patients with refractory temporal lobe epilepsy, so not responding to any types of treatments, and their results showed greater autonomic nervous system activation in people with epileptic seizures versus psychogenic non-epileptic seizures. So people who truly are having epileptic seizures, they see a higher autonomic nervous system rate, which they saw higher sympathetic system activation, and again, reduced vagal tone. So the vagus nerve not working like it's supposed to be working, which means it's not able to regulate the proper blood supply to the brain and allow the body to adapt to stress like it's designed to. They've seen the same thing in children. I'm not gonna go deeply into this because I want to allow time for questions. They've seen the same thing for newborns, right? And this is a critical area because I don't know if you remember your birth. I don't remember mine. I think it's because it's just so stressful. We block it out. Being born is very difficult. It can, even in the best births possible, that's a whole lot. There's up to 60 pounds of pressure, traction on the neck when a child is being born. That's in a normal vaginal birth. Now we throw in things like cesarean section delivery, and there's a whole lot more pulling and torque on those necks. Those children, many children are starting birth in a stressed fight or flight state, and they can get stuck in that state. And if they stay there, we know that changes the brain trajectory, and it changes the way that we perceive the world, and leads to things like anxiety, depression, and other chronic health challenges. This is actually a medical doctor looking at atlantoaxial instabilities, and one way to address this, and this is going to be in a much more severe form, where there's true instability, where a ligament has ruptured and the atlas and the axis bone are just way too unstable. So in cases like that, they will sometimes use surgery to try to stabilize it. That should be a last resort, okay? Because my experience has been that rarely ever is needed. However, here's what they found, that when they do that, when they do stabilize it that way, it would have a decrease in the dysautonomia, meaning that the various that they would see an improvement in the vagus nerve tone when they would address that instability there. And we've seen the same thing in chiropractic. It's not just clinical experience. Here's 3 different studies. Here's one from the Journal of Chiropractic Medicine, where they found that upper neck adjustments impact the vagus nerve, this parasympathetic system, more so than the lower part of the neck, which impacts more the sympathetic nervous system. And it all has to do with where the vagus nerve is in those particular nerve endings. In this journal here, this was another article in the American Journal of Osteopathic Association. They also found the similar findings in the Journal of Spine. So 3 different types of professional journals, not just chiropractic, where they're finding that adjusting the upper neck has a more resting, healing, digesting effect on the system. And this was a review of the literature, looking at nine various studies, looking at adjusting the spine, also other myofascial techniques, and what they do to heart rate variability. And again, the evidence is very clear that that adjusting the spine has a positive impact on the autonomic nervous system. And this was another review of the literature that looked at has over 800 references, not just chiropractic, but other forms of manual therapy, body work. That's why massage, massage feels really great. It calms the nervous system. It has a positive impact on the autonomic tone. Interestingly enough, I've shared this before. There's something called the Mozart Effect. They found that listening to Mozart will have a positive impact on seizure frequency. And it should make sense. That type of music is super calming to the autonomic nervous system, helps increase the vagal tone, which increases the size of your bucket, which means that it takes more stress to then trigger a seizure, right? So all of our strategies should be looking at how do we increase the size of our buckets? Instead, unfortunately, what we tend to be doing is how do we stop doing the things we love? How do we try to, from the outside, alter the system to try to manipulate the seizures and the frequencies instead of just increasing the natural health and function of the body to allow it to thrive the way it's designed to thrive. Now, here's one way that in chiropractic and other fields that we measure autonomic function. It's through paraspinal thermography. The skin temperature is controlled and regulated by the autonomic nervous system. And so thermography is a great way to measure autonomic dysfunction, because we know that the skin temperature should be within 0.5 degrees from side to side. In this particular scan, wherever you see red, blue, or green, it means that it was warmer on that side. Red means intensely warmer, blue moderately, green mildly. So this particular person had a massive imbalance in their autonomic nervous system. It meant that they couldn't even regulate something as simple as their skin temperature, right? So this is a great way to measure that in addition to heart rate variability. So in this particular case, this was a 24-year-old female having grand mal seizures, which started at age 18. She was taking Keppra and folic acid, which did reduce her seizures to 1 time per month, and they transitioned into absent seizures at that point. Now, here's the thing, and I find this quite regularly. She had a prior history of chronic migraines and headaches several times a week and severe fatigue. If I go back far enough in a case, I'll typically find various indicators of growing levels of stress and dysfunction in the system until it gets to a point where it gets so bad that that's when the seizure starts to show up. For her, she was likely having issues with her upper neck, maybe from birth, maybe at some point in her early childhood, to the point where it started creating chronic headaches and migraines and the fatigue issues. She complained of severe issues with focus, and also heat intolerance. So that's again a stressor. She would have increased frequency of seizures when it was really hot outside. And in her scan here, we see a 4-degree imbalance. This is massive. Again, it should be within 0.5 degrees. We see a major imbalance in the skin temperature on the left, and then we see this really big imbalance lower down. Now, all this imbalance lower down, that's likely the result of the imbalance at the top. It's not that she's having an issue in all these areas. It's that the issue at the very top with that part with the vagus nerve and blood supply is impacting the rest of the spinal cord all the way down. So 6 months later, here's her scan, a little bit different, right? We see a massive change, massive shift in her system, but on her quality of life side, we saw a massive shift as well. She only had 1 absent seizure during that 6-month period. She had a resolution of all headaches and migraines. She was not as tired, more focused. She was able to start school, no more brain fog. And she no longer had relapses with the super hot temperatures. And we were in San Diego, where normally it would have impacted her quite intensely. I share this study because this is not related specifically to the autonomic nervous system and brain or blood flow per se, but we do know that and have been doing more studies like this, where we see changes in the brain on things like functional MRI. We see increased levels of activity and better efficiency of the brain after adjustments of the upper neck. In this particular study, they had individuals performing just a random action before and then after the adjustment of the neck. And they found that after the adjustment of the neck, that there was they found it affects regional cerebral glucose metabolism, meaning that the brain used less energy to perform the same action. The brain became more efficient. And they related that to the sympathetic relaxation. So the people had a decrease in their fight or flight response. And here's another study. This was a 2016 study in the journal Neuroplasticity, where they found that the particular part of the brain that is where activity is increasing by up to 20% was actually the prefrontal cortex. This is the thinking, rational part of the brain. It's the resting, healing, digesting part of the brain, right? The sympathetic part of the brain is the cerebellum. That's the or what we call the reptilian brain. It's the part that is more reactive. So when we adjust the neck, they saw in this study on the functional MRIs that actually this was not functional MRI. This was I can't think of the type of study this was at the moment, but it wasn't functional MRI. But they did see this increase in the activity by up to 20% here. So before we go into questions, and sharing like what to look for and to find a chiropractor, I always like to just point this out. This was a study looking at the review of literature for people who had no seizures, no symptoms, no pain or problems in their life. These are people like myself who have been under care. I've been under chiropractic care for 28 years now because I saw massive improvements in my quality of life when I did so. What they found was that these people, even though they did have problems, they saw improvement in everything from their autonomic function to their hormonal system, cardiovascular function, reaction time, athletic ability, reduced labor times. All these different things improved. And it should be hopefully clear by now, because here's the thing. If we have stress in our nervous system, it doesn't always show up. It shows up when it's been there for a long time and more severely. And so for these people, it was simply improving their overall health and function by optimizing their overall nervous system function and blood flow and things like that. And so that's ultimately what I'd love to see happen for you and your families. But for anyone who's having seizures, absolutely need to get checked. I'm going to fast forward through some of these case studies because I want to make sure I cover what to look for. And these cases I presented last year, so you can go back to the Epilepsy Awareness Day videos, and if you wanted to see those, I'll just share this. I did share this last year. This is Elliot. He's now 2.5 years seizure free, so doing fantastic. Here we go. So here's how to find a provider. Okay, so realize that the chiropractic profession is much like any other healthcare profession, that we have specialists. And some specialize in auto accidents, some specialize in nutrition, some specialize in pediatrics. I'm a pediatric and family chiropractor myself. Whatever you do, you need to find someone who's focused on vertebral subluxation correction. Okay, so that should be prominent on their websites. They should have objective testing, whether it's heart rate variability, surface EMG, paraspinal thermography, and/or X-ray. They don't have to have all of those things, but they should have some degree of combination of them. Experience seeing more difficult cases, not, again, like I mentioned in the beginning, in chiropractic college, we don't see those unless they've been in an office where they're seeing a lot of those cases. Chances are they haven't seen a lot. And so you'd want to look for that and ask. If it's a pediatric case, make sure that they have additional training and expertise in taking care of children. The ICPA4kids.org is one place you can find, especially for kids. The IFCOchiro.org is another website. I'm a former vice president of the organization. This is chiropractic.org, also has a directory. And then the Center for Health and Human Potential is my office, our Facebook page, our website. You can email us. You can send us a Facebook message. We'll be happy to help find a referral for you because I want to make sure that you get into the right type of office. Have a couple minutes for questions. Would love to take any if you have some. And if you can't unmute yourself, you can put it in the chat too. If you have other questions too, feel free to reach out to us. Always happy to help, especially again, if you need a referral. Thank you so much for the opportunity to Brad and the whole team, to the Epilepsy Awareness Day. I hope this has been valuable for you. I hope that, okay, I see, let's see, is this an ongoing process? So it's a great question. So typical care plan, it depends upon what's found on the various testing. Typically, the corrective process takes somewhere between, I would say somewhere between 3 to 6 months, potentially 9 months for full correction. And that's monitored over time through the various types of testing. Initially, frequency of visits typically needs to be closer because the body is used to the old patterns, both that has tight muscles, weak muscles, tight ligaments, weak ligaments, also muscle memory of where the position of the bones have been. So that's where time and repetition comes in initially. So I mentioned 3 times a week, even sometimes I was doing 5 times a week in the initial phases of more intense cases, and then going down in frequency as the testing showing better, as people are holding their adjustments. That process, we go down to twice a week, then down to once a week as the body's holding. That process takes typically somewhere between 4 months to 6 months, and then we can often look at going out to every other week, and then more wellness or supportive care at maybe once a month. Now, whether or not someone decides to do that on an ongoing fashion is totally up to them. At this time, I can't think of some of those cases where I saw relapse, except for when we didn't have full correction in the initial phases of care. Like we didn't do the full process of the corrective phase before going into a more supportive phase of care. Any other questions? I know we might be out of time here as well because we're at the hour mark. If there are any other questions, I'm more than happy to take them either on my Facebook page, Center for Health and Human Potential, or emailing us at that email address, and be happy to chat with you as well. Again, I'm not in active practice at the moment. The doctors in my office are highly trained by me and have seen multiple of these types of cases, even currently, so they can take your questions. Whether or not you ever come into our office, it doesn't matter. We're here to help and provide direction if we can.
Thank you so much, Dr. Tullius.
My absolute pleasure. Thank you so much for having me back. It's absolute pleasure. I look forward to next year back at the Disneyland Convention Center.
Yes, definitely.
To see everybody in person.
Yes.
All right, guys. Thank you so much. Have a wonderful day.
Have a great day.
All right. Take care.